Moderna says a new experimental COVID vaccine boosts protection against the Omicron variant by combining its original shot with the one designed to target Omicron. And Moderna will have an updated vaccine for booster shots this coming fall. Well, joining us now to break down how strong this new booster is Dr. Anthony Harris. He's a CEO and medical director at HFit Health. Thank you so much for joining us. Just how much more effective is this new vaccine against COVID and this Omicron variant?
Sure. Well, thank you, Kelsey, for having me first and foremost. And if we look at the effectiveness data that has been published, surprisingly, there is no definitive effectiveness published. Why? Because this vaccine was tested mainly during the time of Delta, right? But if we look at in terms of the boost, in terms of the increase in the antibodies, it's tremendous, up to 8 times increase in the antibody response for Omicron specifically, according to Moderna. So that is very positive news that this booster will be very effective at ultimately providing protection for the many that will need it this coming fall.
My question is, will it help prevent the infection? And if so, really, what is the percentage? By how much?
Sure. So if we go back and look at data that was published regarding the first 2 and 3rd dose of Moderna or Pfizer, in this case, we can see that there is evidence that it will protect most likely against active or symptomatic infection to the tune of 49.4% if we're going back and looking at, again, the first booster. And so we know that boosting is effective at preventing symptomatic disease, as well as tremendously effective at preventing hospitalization and death. And those numbers are 76% and 86% respectively if we're looking at protecting from the vulnerable populations.
I think a lot of people are asking, if they've already gotten a booster, should you wait to get a booster if you're eligible now until this new vaccine is available?
Yeah, so clearly the answer is no, right? Because we know that Moderna has yet to submit for final approval for emergency authorization of their booster, of this particular booster that we call a bivalent booster, meaning that it attacks Omicron as well as the Delta and previous variants. It won't be until the fall that they're expecting it to be approved and available to the masses. And so if we look at the numbers in terms of days from this point in time, 103 days until the fall begins. And so we know that booster effectiveness starts to wane in as little as 60 days after you receive a booster. So if you are amongst those who have already received your first booster, and are eligible for another one, definitely still go get your additional booster. If you haven't received the booster, go get your booster because it's going to be effective before and be worthwhile before the fall comes.
Well, there's been a COVID-19 vaccine rollout plan for children under 5 years old by the Biden administration. Is the vaccine effective for children younger than 5? We know most children can fight this off and are asymptomatic. What are your thoughts?
Sure, Kelsey, this is one that hits home for me, right? I have 2 little ones, a 5-year-old. We got her vaccinated and boosted, and I have a 20-month-old. And so we've been waiting, my wife and I, to get him boosted, and we certainly will do so. And here's why: because first off, we know that these young children are still vulnerable to health outcomes from COVID-19. And it's not so much that they're going to be hospitalized or die. That is still possible, but very little risk there. We know that COVID-19 does increase risk for heart disease, does increase risk for type 1 diabetes. And so we don't have enough information and data around the long-term effects from COVID yet to understand the impact to these young folks. And so getting a vaccine and getting a booster when appropriate will be effective at helping reduce those risks in this population less than 5. And if we look at the effectiveness is there for both Moderna and for Pfizer. 6 months to 5 years for Moderna and 6 months to 4 years for Pfizer. So the answer is yes, our children need this vaccine, and we're going to be the first to get our little one vaccinated when appropriate.
I think a question that a lot of parents have is, what are the expected side effect risks that you will see in children after they get this vaccine?
Sure. Good news here too, as well, Kelsey. If we look at the studies from both Moderna and Pfizer, the side effects are equal to that of placebo. Placebo being no medicine at all, no vaccine, just a sugar water, if you would. And those side effects amongst the Pfizer booster in particular and vaccine in particular in this demographic is just fever, right? So we're not talking anything dramatic. I know there was fears around heart inflammation, et cetera. Those fears have been squelched in terms of the data, and that's why we're seeing approval on the precipice right now from FDA.
Dr. Harris, thank you so much for joining us and for your time.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.